Hello, thank you for joining me on this webinar about processing new patients. As you very well know, processing a new patient can be daunting and it can be sometimes even uncomfortable. Processing a new patient, however, is what will make your clinic grow. Patients will come to you because they like you, they've been referred to you, or somehow an ad brought them to you. Will you keep them? And how long will you keep them is a big question. So there are questions and there are steps to take to make sure that a new patient is processed properly. And what are those 7 steps? Let's go through one of them at a time. The first thing is to make sure that you thoroughly review the new patient intake form. Make sure that every single part of that exam that you would like to perform is done properly. Go through every step. And if you're not comfortable with the form that you're using, get a new form. There are plenty of forms that can be gotten out there. I know that for our clients, for instance, we have clinics throughout the country, over 1,200 centers in 45 states. Many of our clients will take the forms that we give them that are comprehensive and adjust to their needs. They'll add questions or take away some questions. Make sure that the forms that you're using are the ones that you like and the things that you feel confident and comfortable in asking. Shouldn't be redundant questions, but at the same time, you should need to ask all the questions that you want to know about, the things that are necessary to make the patient comfortable, the things that will get you through the exam and get you the answers that you need. Remember, by understanding the patient's chief complaint and the medical necessity, you'll be able to come up with a proper diagnosis and prognosis and give a proper treatment plan. But this is something that you'll need to go over more than once. I'm always disturbed by the fact that some doctors just take a form and go through it, and the things they don't want just skip. Make sure that your form is customized. Customize it to what your needs are, specifically to the type of clinics that you're running and the things that you want. And know what it is. Here's number 2. Once you have done the proper exam, once you've performed and conscribed to the thorough exam, immediately to the patient acknowledge the chief complaint. So, Mrs. Johnson, I understand that your main chief complaint that you're here today is this. It's the right knee, it's a left shoulder, it's the headache, it's a back pain, whatever the case may be. Acknowledge it. Let the patient know that you're communicating. Open up this bridge of communication between the both of you and make sure that they understand that you understand them. I realize that many of you are thinking about the whole process and whether or not you're going to be able to sell to this patient some type of service. This isn't the way to do a proper exam. This is not the way to grow a great clinic. Absolutely not. Focus on the patient's need and exactly what it is that they're thinking about. And connect with them. Touch them right where they need to be touched, which is in their heart, to know that the emotive questions have been restrained, that there is now an emotion between you and them, that there's a connection. Acknowledge this chief complaint and thoroughly discuss it. So it is your knee. Is it bothering you when you drive or when you get up from the couch? Is it something that you feel all the time or some of the time? Is it only in one side of the knee, and is it early in the morning or late in the evening? Is it after a lot of activities or only some time? Thoroughly and immediately acknowledge the chief complaint and cover that information. Here's number 3 on our list. Take the time to explain your findings and treatment plan. Take your time. This is a new patient. They're not knowledgeable about what their condition is. They know their pain, they can feel it. But they don't know anything about your office, and they certainly don't know anything about you. At this point, they're just total strangers. To make them part of your family, you don't just say, come on over, here's the treatment, and that's it. No, you've got to thoroughly explain it, step by step, what it is that you're going to do. Don't make it a sales pitch. Make it so that it comes from the heart, because it says, the words that come from the heart enter the heart. You've got to know that. You've got to remember that. You've got to make a note of this and always act that way, so that they're comfortable. Explain the report of finding in a way that is understandable to them. Don't start pulling some of those words nobody understands. This process causes erythropoiesis. They have no clue what that word means. And if you're going to discuss it in a way that is common to them. Use the language that will reach their heart and mind and be able to discuss it with them in a proper way. Remember, this is a real person. This person is someone's mother or brother or someone's father or friend. You would want to be treated that way. Next is ask for many questions. As many questions as you want. Remember, you are not selling. This is not that. They are buying. They're trying to figure out whether or not they should stay with you, whether or not you're the right doctor. So ask all the questions that you need to, things that make sense, things that will give you more understanding, things that will get you where you need to be. Ask the questions that are pertinent to them. This is not the time to start talking about vacations and where you've been and what you do. No. Focus on them. Focus on their needs. Here's the next one. Don't exaggerate. Do not exaggerate. If, for whatever reason, you think that your treatment or your clinic or your staff is the best, don't exaggerate. Be honest with what you say. Be honest with who you are and what it is that you want to speak about. Let them know that you care. Let them know that you'll be there. It always bothers me when I hear somebody just overselling and telling you so much about what they do. The saying, and you've heard it many times, it's better to end a promise and over-deliver. Say less, because that's always more. Tell them what they need to hear to feel comfortable. You want them to leave your office uplifted. You want them to walk away and say, wow, what a great doctor. What a pleasant office. What a nice experience. Something that I would tell everyone about. You want them to walk away knowing for a fact that you are an honest person and that you have delivered your information with integrity and truth based on facts. The tests that you've done, the things that you performed, the examination that you've had right there. This is something they need to see. Irrespective of the patient's race, color, creed, age, financial situation, or ability to pay, you've got to be compassionate. You've got to be kind. You've got to be sweet. You've got to be giving. It's an honor and a privilege to be a doctor. But it's not always the right way to act by you thinking that you have something above and beyond that person. Because you don't. The truth is, you've been given the power to heal. But that power could be taken away from you. It was given to you because you showed competency as a good student. Now you have to show competency as a great human, as a kind human, as someone that they would converse with and be with. As always, I wish all the best for you. And I look forward to hearing good news above and beyond. Great things. Let's make it happen. And God bless you in everything that you do. I hope and pray that this will always help you become a better doctor. Thank you. Please subscribe to my YouTube channel and click the notification bell to get my latest update.